Thanks, everybody. Appreciate you being here. Can everybody hear me? Okay, fantastic. The importance of your questions, I can't stress enough, because it's not a matter of me just standing up here and talking. I want to have some questions. I want to be able to bounce back and forth with your concerns, because this is all about you. That's what Medicare and Me, the booklet, is all about. How do you use Medicare? And so that's why these seminars are very important. We always talk about it being open season. Open season means that the seniors tend to feel like they're in the gunshot range. And we want to try to make some of this easier for you to understand. We want to make sure that you have a better comfort level. There's nothing for sale. I'm not selling anything. I'm educating. I want to provide everything that we can so that you're not so surprised when you look at things. So that that paperwork that you're getting at home, you have a better idea of what and why did they send that paperwork to you. What we're going to talk about is Medicare and Medicare Advantage. There's a difference. Medicare, the alphabet, A, B, C, and D. We're going to talk about the Medicare Advantage of the what, why, and the how. What is the difference? Medigap and Medicare Supplement. They're the same. It's just a name difference between Medigap and Medicare. Medicare Part D, otherwise known as drugs. We're going to talk about the Advantage enrollment time, which is coming up starting next Tuesday, the 15th. Your options, some additional resources, and I want to make sure that everybody understands the meaning behind the new CMS card, the new Medicare card. You're no longer exposing your Social Security number to the world. That's extremely important. But each one of those numbers in that specific area means something when it's scanned in. So I want to make sure that you have that when you go to your doctor's office. Because the doctor's office can no longer look up your Medicare benefits based on your Social Security number. Okay? You have to have your card for them to do that. The doctor's office cannot look up your Medicare benefits based on your Social Security number. Used to be able to do that, but now with this new number, they can't. So you have to use that number to look up information about a beneficiary. Okay? All right. So Medicare has a long history, right? President Truman originally proposed it in 1945. President Kennedy, way back in '61, recommended the national program, but it took until '65, another 4 years, before it was actually enacted. President Truman received the first Medicare card. Okay? 19 million people were in Medicare in the first year. Today, over 66 million. It gives you an idea, there's a lot of people, and we're aging in about 10,000 people a day. Okay? The Balanced Budget Act of 1997 established Part C. At that time, it was called Medicare Plus Choice. We changed that name in the Modernization Act to Medicare Advantage. There are two roads to Medicare, and I want you to keep this thought. My right arm is Original Medicare. Original Medicare means Medicare provides the coverage directly to you through Part A and Part B. My left arm is Medicare Health Plans, which includes Medicare Advantage. Private insurance companies, employers, unions provide Medicare health plan. Part A and B and Part D is included in some of the plans. The costs, the coverage, and the rules can be different than Original Medicare. That's what's really important about Medicare Advantage. The key is there are two roads. Those roads are never going to cross. Those roads are never going to come together. You choose to go down this road, you're going down Original Medicare. You choose this road, you're going down Medicare health plans. Okay? So there's the picture. When you look at your coverage and your need based on your medications, based on how much you go to the doctor, based on what your medical conditions might be. You then need to make that decision. Can you make one decision and never change? Absolutely. Can you change every year? Absolutely. That's the importance of this time of the year. If you want to make changes, if you need to make changes, now is the time to make changes. Okay? Excuse me. So let's talk about Medicare itself. The Medicare plan or Medicare design is based on A, B, C, and D. Medicare A is inpatient hospital, skilled nursing, home health related to a hospital stay, blood, and hospice. You pay for Part A while you're working. Some people say that you get Part A for free. That's not true. You've already paid for it. It's not free. You've just paid for it over your lifetime. There is no additional monthly cost when you're retired, except if you didn't have enough hours. You didn't work enough hours, you could have to pay a fee for Part A. Very few people are in that position, but it does happen. All right? There are deductibles, there are coinsurance when you use Part A benefits. Part B is everything that's not hospital. So it's your clinic visits, it's your outpatient surgery, it's durable medical equipment, all right? Supplies, preventive services, some home health, okay? Most people will pay a monthly premium, which is taken out of your Social Security check. Now, some people retire at 65, they don't take their Social Security. So how do they pay for their coverage? They pay for it just that. They take it out of your check, you set it up so that they take it out of your account. So you don't have to take your Social Security, it doesn't have to come out of there. There can also be a cost, deductibles, coinsurance, each time you use Part B. Now, there are things not covered under Original Medicare. And if they're not covered by Medicare, they're not covered under a supplement. So such things as acupuncture, or more importantly, the one I always concentrate on, hearing aids and fitting exams. Now, why that's not covered, I've never understood. I've been doing this for over 30 years, and to me, that's something that should be in there, but it's not. Okay? Same with orthopedic shoes. I think there should be a discount at least for folks, we need special shoes later on. All right? Some vaccines, syringes, and insulin, a lot of that now is changed that it's free. That's part of the reason it's not covered under the plan, because you can get a lot of the diabetic supplement material for free. Medicare Part C. Now is where we start to get a little confusing. Medicare Part C are Medicare Advantage plans. These plans are called Medicare replacement plans because they do just that. They replace Original Medicare. So if you purchase a Medicare Advantage plan, you are no longer within the Medicare A and B Original Medicare. Okay? That's an important point. Medicare Advantage plans are generally an HMO or a PPO. Health Maintenance Organization is an HMO, Preferred Provider Organization for PPO. We'll talk about some of those differences in a little bit. The companies, the insurance companies selling these plans, have contracts with Medicare to provide that coverage. The plans apply premiums, deductibles, coinsurance, that all can be different than Original Medicare. Okay? Because you're dealing with the insurance company. You're no longer dealing with the government. D stands for? Always have a little fun with that. D stands for drugs. It's the easiest one of the alphabet to remember. Okay? Back in 2006, these plans became available to everyone with Medicare. These have changed dramatically over that 13-year time frame. That's what we're going to look at in a little bit. Each plan has a different monthly cost, and you will normally pay some money when you pick up your medicine. You're going to have a copay. You're going to have some kind of coinsurance. There's very few medicines that are a zero cost. Other Medicare health plans. There are plans called Medicare cost plans. They're only available in certain areas, and the point of them is that they provide out-of-network coverage. Okay? PACE plans, programs for all-inclusive care for the elderly. A whole lot easier to say PACE than it is that sentence. Members must need nursing home level care and be able to live safely in the community with the help of PACE. So that's a very unique subset of people. Medicaid plans, sometimes called Medi-Medi. It's also called dual eligible, where you're eligible for Medicare because you're over 65, but you're also eligible for Medicaid, which is state based on income. Okay? Members are eligible for both. Now, let's talk about how the plan works. Right now, Medicare has not released any changes yet for 2020. So we're looking at how original Medicare works today. Okay? Right now, if you entered the hospital, you would have a deductible of $1,364. All right? If you're still in the hospital after the 61st day, you're now going to have a daily copay of $341. If you're still in the hospital after that 90th day, then you're going to enter into this $682 charge, which is part of your lifetime reserve. If you're still in the hospital after 150 days, all the costs are on you. That's how original Medicare works. Now, I asked this morning, how many people are in the hospital for 150 days this time? Okay? The hospital actually had 2 people just in this last year that have been in the hospital for over 150 days. I have not heard of that in 3 years. But the point of that is that when Medicare was designed back in the 60s, this is what happened. People went into the hospital and they stayed there till they got well. We didn't have all the outpatient services that we do today. So Medicare, people say Medicare changes all the time. Well, really? It hasn't changed since the 60s. Really hasn't. Plans have changed. Medicare Advantage has changed. But Medicare itself really has not changed. Okay? How about skilled nursing facility? If I've been in the hospital, I can go into a skilled nursing facility, and the first 20 days, I don't have to pay anything. That's the recovery point. That's why people go to the skilled nursing facilities. If you're in over that 20 days, 21 to 100 days, now again you've got a copay of $170 a day. If you go past that 100, then that cost is on you. Everyone who is a part of Medicare and wants to have a supplement or Medicare Advantage must enroll for Medicare Part B. Okay? Now, Part B coordinates with Part B, outpatient. That's what this premium is for. That premium is the 19 premium. That premium will go up slightly for 2020, but they haven't told us what it is yet. Okay? You also, under Part B, would have a $185 annual deductible. Okay? That's a low deductible in grand scheme. You also would have deductible plus 20% of Medicare-approved doctor services, outpatient therapy, durable medical equipment. You could have some various co-pays for outpatient services, including diagnostic tests and x-rays. You have zero cost for Medicare-approved home health services, zero for Medicare-approved clinical labs. Medicare will pay all costs of the first 3 pints of blood, and co-payments and co-insurance for other services. questions about this. Generally, somebody has some confusion with those numbers. And it's a deductible. So let's say I went in today. 3 months from now, I have to go back in. Do I have another deductible? No. No. Remember our 90 days here? So you have to be careful of that rule. When you're within the time frame, you don't have another deductible. You'll still have some costs, but you won't have another deductible. All right. Medigap, otherwise known as supplement. Okay? It's the same thing. It's just a different word, Medigap or supplement. Medigap is the word the government uses because it's covering the gaps from original Medicare to your coverage. That's the point. They're sold by insurance companies. The insurance will cover the expenses that original Medicare. So, for example, that deductible. Your supplement, in most cases, will pay that deductible for you. So it's not something you see out of your pocket. Okay? The name is derived, as I said, to bridge the gap. Now, this is where we have new rules. So that bigger sheet that you have, you may want to pull that out right now, and we'll take some notes. A Medigap policy can never be different no matter which insurance company you purchase it from. A Medigap policy can never be different than what is in front of you on that sheet or on this screen than what is here. So I don't care if it's United through AARP, I don't care if it's Humana, I don't care if it's Mutual of Omaha, pick another name. This coverage is universal. It has to be the same. The only thing that can be different is the premium. Every insurance company has a different book of business that creates a different premium that they're selling. So Plan G could be $170 with Mutual of Omaha, and it's $180 with AARP, or vice versa. Okay? So it literally depends on the insurance company what the cost is. The biggest change in this is over here on the far right. Medicare first eligible before 2020 only. Now, let's talk about that very quickly. If you're 65 today and you already purchased Plan F, is it going away? No. If you have Plan F today, you can keep Plan F. I'm not saying the insurance company might not change the premium down the road, but you can retain the policy. If, however, your birthday is February 15th of 2020, you cannot purchase Plan F. Okay? So if someone is turning 65 in 2020 or beyond, they are not able to purchase Plan F. Now, why is that important? It's important because Plan F was what we called the 100% plan. Plan F picked up that $185 Part B deductible. So going forward, the Plan G, okay, picks up everything that Plan F did, except what? That Part B deductible. So if you want a similar plan, Plan G is similar to F. So tell all your friends, all right, that it's not as gloomy as some are painting it. That there is an option. Now, there's some, down here at the bottom, you know, the Plan F compared to the Plan G, there is a high deductible option. Plan G, in 2019, that deductible was $2,300 if you took Plan G for a high deductible. What that deductible is going to be in 2020, I don't know. I'm assuming probably $2,500. It may be less, it may be more, but I'm assuming $2,500. You also have out-of-pocket. What's our out-of-pocket limits down here? The only two plans that have out-of-pocket limits are K and L. Okay? Now I got a question for you, and I'm going to do this a couple of times. What's the difference between cost and premium? What's the difference between cost and premium? Cost is your total expense out of your back pocket. That includes your deductibles, it includes your premiums, it includes your co-pays, it includes your co-insurance. It's anything and everything that you spend. That's the difference between cost and expense. Because what happens with a Medicare Advantage plan? What's the premium on a lot of Medicare Advantage plans that they advertise? 0. Okay? Is that your cost? No, that's your premium. Okay? Accountable care organizations is a relatively new item, last 5 years, but accountable care organizations are where hospitals and physicians and other provider groups group together to deliver more effective and coordinated care. Hospitals and physicians may be rewarded or penalized depending on the type of outcomes they can help a beneficiary have. If they're improving your care, they can make more money. If your care isn't improving, or they're not taking care of you the way they should, then they get penalized. You will be notified if your doctor has decided to participate in an ACO. Your Medicare benefits do not change. Emphasize that again. Your benefits don't change. You will be told if your health information will be shared with your doctors and other providers. You make that choice. You get that letter from the doctor's office that says, we're in this ACO, we'd like to share your medical information with XYZ. You can say no. I don't want you to, but you can. Here's the kicker. If you're in a Medicare Advantage plan, you will not be in an ACO. Because a Medicare Advantage plan does similar things. They're managing your care. Okay? They're using their doctor. I see you shaking your head. They're managing your care. Your doctors are doing it. Show of hands very quickly. How many of you are on a Medicare Advantage plan right now? Okay. I realize that side of the room. All right? So, this is very important from a Medicare Advantage standpoint. So we'll talk more about this. Okay. Which road are we going to go down? You can either take Medicare Part A and nothing else. You can take A and B and nothing else. You can just be an original Medicare. Okay? You can do A and B plus a supplement. You could also do A and B plus the Part D and not do a supplement. Part D, just have a drug coverage. Or you can do A, B, D, and a supplement. Okay? How about the other road? Remember, we're going down the left road. We're going to do Medicare Advantage. So Medicare Advantage, you can just do Medicare Advantage. No drug plan. Or you can do it including D. You can add a drug plan. Or, oh wait, I can't do that. I can only do Medicare Advantage, but if it doesn't have drugs, I can't add a drug plan. How about a supplement? Why not? You what? You can't have both, correct. Our roads can't cross, can they? Okay? The importance of Medicare Advantage is right there, your ID card. That ID card is what the insurance person at the clinic or the hospital wants to see when you come in. Because you don't have a supplement, you have Medicare Advantage. Okay? It replaced your Medicare. That Medicare Advantage plan may or may not have drug coverage. It covers all the services that original Medicare covers except hospice. Some new Medicare benefits and some costs for clinical research studies. You also could have some extra coverage. Now, I'm going to emphasize, may. The late night infomercials make it sound like the dental coverage and the hearing coverage and silver sneakers and, it's just all there, right? Okay? Let me tell you, it's not all there. May offer. May or may not include prescriptions. May or may not have benefits similar to a Medigap. May or may not cost less than Medigap. I'm the anti-infomercial. Are not required to have the same deductibles and co-payments as original Medicare. Okay? So remember that sheet, 1364, okay? No. These, under Medicare Advantage, you can have different co-pays, you can have different deductibles, so on and so forth. It does not coordinate with the Medigap, what we just talked about. Now, what types of Medicare Advantage plans are out there? Well, we have a health maintenance organization known as an HMO. What's the problem with an HMO?
Has to be a certain area, like they both have in big cities, not in smaller areas.
As a rule, correct. And it has no out-of-network coverage.
You choose your primary care doctor, you have to have referrals.
Correct.
Everybody else.
Correct. Okay. How about a PPO? PPO is a little larger, generally used in rural areas like here. Okay. And it still includes out-of-network coverage. You're just going to pay a little bit more for it, okay, for that treatment than what you would have. Special needs, excuse me, special needs plans are becoming more and more prevalent in the area. The point of special needs is I have a group of individuals who are diabetics. I have a group of individuals who have congestive heart failure. I have a group of individuals who have end-stage renal disease. They're going to be grouped together by an HMO, and their care is going to be managed, including prescription drugs, through that special needs plan. Okay? That's important because we have a lot of people with special needs. All right? Private fee-for-service used to be the most popular plan purchased when these came out 13 years ago. Today, you're going to see in a moment, they're almost gone. Medical savings account, another way to have a high deductible, and Medicare helps pay for some of your costs, but again, very few people utilize it. Let me go back here a moment. Well, that's too far back. So what she's talking about is that when you have Medicare Advantage, you have your insurance card. There are a lot of people who don't understand that when you have Medicare Advantage, that's it. There's no supplement, there's no extra. So they'll hand you their Medicare card and say, bill Medicare. I can't. Medicare Advantage is Medicare Advantage. It's whatever insurance company you have the coverage with. Okay? You still want to keep your Medicare card. You want to have that card on you. I'm not telling you not to. But the doctor's office needs your medical card from the insurance company. Okay? Okay. So we were talking about networks. Original Medicare has the largest network. If a doctor agrees to take Medicare, which 99% of all doctors do today, 99% of all hospitals take Medicare, original Medicare, plus a supplement. Private fee for service is the next largest. Your PPO is the next. Notice how we keep shrinking. Then we get to an HMO with a point of service. Point of service means that it's an HMO, it's a smaller network, but you have the opportunity to choose at the time of service who you want to see. Okay? And then HMO being the narrow.
Would you explain that private fee for service?
Sure. Private fee for service, I think there's maybe one plan available in the area, okay? Private fee for service is a way that the insurance companies used to have it as an open access, meaning there was no network, you didn't, If the doctor agreed to accept the charge, that fee for service, then that's what it was. Okay? But unfortunately, Medicare has modified that a private fee for service has to have a network. It's generally a PPO network. So why do I do a PPO and a private fee? It's not, okay? As an insurance company, I'm just spending money to manage something I don't really need. Okay? That make sense? All right. Medicare Advantage. Even though this side of the room has Medicare Advantage almost exclusively, that's not the way it is. Only about 34% is nationally is part of Medicare Advantage. That's divided by 14 million in HMO, 8 million in local and regional PPOs. Here's your private fee for service. We're down to 107,000 compared to those large millions. Medical savings accounts, even more is less. PACE plans, and our cost plans. Now, we don't have a cost plan in our area because we have PPOs. So that's not even in our thought. So what's going on locally? Well, locally and nationally, we're still seeing an increase. Why? Because we have 10,000 people aging in, and a lot of those 10,000 are already in HMOs. They're familiar with an HMO. They think it's the same thing as they have now, so that's what they take. Is it the same as a commercial HMO? No, it's not. Locally, we are much lower in Medicare Advantage enrollment than on a national basis. There's a lot of reasons for that. Smaller area, we're not using an HMO as a rule, okay? And people tend in the rural areas to purchase supplements, not Medicare Advantage, because that's what they're used to. That's what they've heard about all their lives, okay? Is this going to change? Each year it inches up a little bit. This has not changed for 2 years at this point. Now again, we're only talking 10,000 people compared to the city of Chicago, compared to the city of St. Louis. Okay? So you have to think of your relativity of how many exposed lives do I have compared to who's purchasing. Okay? That make sense? All right. Now let's talk about, in some people's cases, our favorite thing. All right? The key to the drug programs, and again, Medicare Advantage may or may not include the drugs. You have to be careful when you're purchasing. Does a Medicare supplement include drug coverage? No. Never. None of the plans available do. 20 years ago, there was a plan that did. That went away about 25 years ago, okay? The key is that all plans, all of the drug plans, have to be equivalently equal to this design. This is Medicare's design. This is what Medicare says all plans have to be similar to. Now, similar is not the same, right? So the baseline is there's a $435 deductible before we're going to pay any of your prescription costs. After that deductible, the plan that you purchase is going to pay 75% of that cost, and you're going to pay 25% until you reach $4,020, which includes that deductible, for the year. Now you've reached $4,000. What does that mean? That means you're in that donut hole or that gap. While in the donut hole, you will pay 25% of a generic drug cost and 25% of negotiated price on the brand name. Now, that's extremely important because the next slide is going to show you that is so much improved over 3 years ago, you're paying a lot less out of your pocket than you were in the gap. Okay? The drug manufacturers have to discount those higher end drugs. So it has to be discounted before you even see it. Okay? You also have the opportunity, if you're on some of those higher end drugs, that you can negotiate directly with the manufacturer, where the manufacturer will either pay it for you, reduce it again, make it a lower copay, and these are done by pharmacists and doctors. They help you get that done. So don't be afraid to ask. No one wants you paying more out of your pocket than you should. Okay? Like Winnie the Pooh up there in the corner, most of us would like to get out of the hole. And the key there is to get out, you have to incur $6,350. So $4,000 got you into the donut hole, $6,350 gets you out. Okay? That's a big number, but compared to a couple of years ago, it's a smaller because you get to it faster. Okay? So again, you've got your deductible, your share at 25%, your share in the donut hole. That's how we get to that $6,350. The drug company discounts for brand names are credited toward your $6,350 in out-of-pocket costs. Why is that important? Because you literally have two buckets. This right-hand bucket is your cost. Your 25%, it's your copays. Over here is the actual cost. When you buy the drug, that actual cost is what counts towards that $6,350. That's why I say you get out of the donut hole faster. Okay? That make sense? When the donut hole is filled, the coverage gap ends and you're eligible for catastrophic. That just means I'm out of the hole, that gap, and now I've got the rest of the year left. The rest of the year might be a month, the rest of the year might be 6 months, might be 9 months. I've seen folks who, because of their expenses, they'll be in the donut hole by February. Okay? They'll be out of it by March or April. So, just depends on the type of drugs that you're taking. Once you're in that catastrophic area, you're either paying $360, $895, or 5% of the total cost. Okay? Now, you know, that 25% is important. Look at what it used to be. And also think back, this is only 13 years ago that we didn't have drug coverage at all. So we were paying for our drugs out of our pocket when we were over 65. Okay? Big change. All right, Medicare Advantage plans may or may not include prescription drug coverage. The ones that do not include it, you have to be careful, because why? Number one, you don't have coverage. Number two, if a Medicare Advantage plan does include prescription drugs, it must be actually equivalent. You have to read the plans. You have to know what you're buying. Because if a Medicare Advantage plan doesn't have drugs included, you cannot purchase a standalone plan. What happens if I purchase a standalone drug plan? What's that in the bold say? Will automatically be terminated. Did I say I was terminating your drug coverage? No. I said I was terminating your Medicare Advantage plan. You have no coverage at all. So if you hear somebody saying you have to have a drug plan with a Medicare Advantage plan, no, you can't. You can have it embedded, it can be a part of it, but you can't buy the two separately. Okay? Extremely important. I've had that question over the years. I've had people, hospital people telling me of tears with people finding out they had their coverage terminated and they didn't even know it. Okay? Medicare supplement policies that have RX coverage may be continued. Remember I said there was a plan way back when? Well, some older people at this point, in their 80s, may still have that plan. But you won't see that in the area. Medicare says that RX coverage and Medigap policies may not be good as coverage in Part D. Depends on the person, okay? Since 2006, no new Medigap policies have prescription coverage. So you can't buy a Medigap policy with prescriptions. You have to buy it separately. Okay? And the most important part, cats and dogs don't get along in Medicare Advantage. Okay? All right, questions? Medigap policy and join a Medicare Advantage. You have to drop your Medigap policy. You can't retain Medigap and Medicare Advantage. Your Medigap policy can't be used to pay Medicare Advantage copays or deductibles. So again, you're just going to spend money. Why? Okay? However, if you have a Medicare Advantage plan, it's illegal for anyone to sell you a Medigap policy unless you're going back to original Medicare. If you're dropping a Medicare Advantage plan because you want to buy a supplement or a Medigap policy, that's fine. But if you want to have a Medigap and a Medicare Advantage, that's illegal. Okay? It's not illegal for you, it's illegal to be sold. I want to point that out. Participation. You are not required to join a Medicare Advantage plan. There is no penalty to join a Medicare Advantage plan. There wasn't a penalty in 2019. There wasn't a penalty in 2018. There's never been a penalty. That's wives' tales again. Okay? You can decide to join a Medicare Advantage plan next year. You can buy it now, change it next year. You can buy it 2 years from now. It's whatever your choice is. You control the choice. To join a Medicare Advantage plan, you must be enrolled in A and B. Okay? And you have to be in a planned service area, except for special needs plans and end-stage renal disease, which we talked about. If you participate in original Medicare and make no changes during the open enrollment period, you will stay in original Medicare. If you participate in a Medicare Advantage program and make no changes during the open enrollment period, you will stay in your current Medicare Advantage plan, assuming that plan is still offered. Key is you're getting a letter right now that tells you changes that are coming in your Medicare Advantage plan. You notice in that there's nothing to sign, is there? So what happens if I sign something for someone? What's that going to do to my current plan? It's going to change it. Because you don't do anything to keep what you have. So you have to be careful of fast-talking people who want you to sign something to keep what you have. No! To keep what you have, you do nothing, as Sergeant Schultz used to say. Okay? Remember, you do not make changes in your coverage, nothing changes. The choice is always yours. You can join a Medicare Advantage plan when you first become eligible for Medicare, age 65. 3 months before or after your 25th month of Medicare eligible disability. So somebody who's under 65 can join a Medicare Advantage plan. They can also get a supplement at that point. During the annual open enrollment period, December 15th to 17th. Each year, you get to make choices. Okay? That's important. But I made a mistake. I want out. What do I do? How can I? What can I do? Here it is. If you move out of the planned service area, you can make a change. What's our planned service area? Our county. So if I move to St. Louis, do I change my plan? Yes. If I move to Illinois, don't. Do I change my plan? Absolutely. Okay? You have to have both be in the service area and you have to have an eligible plan. You can have Medicare and Medicaid If you qualify for Medicaid, then you should be taking advantage of Medicaid. Medicaid will help you pay for things with Medicare. You qualify for extra help. You live in a skilled nursing facility. Remember, if you're in a skilled nursing facility, you can make plan changes. Maybe you go into a PACE plan. Okay? You disenroll from an employer group health plan. If I'm on a group health plan, I don't need to make a change. I don't need to buy Part B because I don't need it. My health plan is paying for all of it. Okay? You switch to a 5-star Medicare Advantage plan. Anybody seen a unicorn lately? No? Okay. That's how often you're going to find a 5-star plan. Most of the plans are 3s, 3.5, maybe a 4. Okay? The point of a 5-star is that they get to sell their policy anytime during the year. They don't have to wait for open enrollment. Okay? But it's also very difficult for them to acquire that rating. Okay? And who makes up that rating? You, the hospital, the providers, everybody, the pharmacists. All of these interact to determine what kind of star rating they should have. Now, this is during open enrollment. January 1, you may move back to original Medicare or switch to a different Medicare Advantage plan if you do so before March 31st. So you enrolled like you should, or you stayed where you're at, but on December 28th, you get a letter from your doctor who says, I just retired. And I don't really like the other people in that practice. What am I going to do? Well, you can go back to original Medicare. You can change to a different plan with a different doctor. You just have to do it before March 31st. Because April 1st, you're locked in until open enrollment, which means you're locked in until January of the next year. Okay? So there are ways to make changes even after open enrollment. So we're back to our roads. Has anybody made a decision? Have I given you anything that would make you make a decision? No. I've given you a lot of information. As somebody said this morning, they felt like they'd just been hit with a fire hose. Okay? I apologize. There's a lot to go through, okay? But we have to look through it. So you've got your decision calendar. It starts right now. It starts this time every year. Okay? Your plan starts January 1, and you've got your bailout session January 1 to the 31st, till March 31st. This is new. This just started last year. Okay? It's extremely important because now people have an option. They can say, oh, wait a second, it's not really what I wanted. I didn't understand that. Or, I can't have this HMO. I don't have any doctors in the area. Okay? Your senior options. Original Medicare. If all I want is Part A, I'll stay with Part A. All I want is A and B, I can do that too. I can get a supplement. There are 40 insurance companies who will love to sell you a supplement. Are they all the same? Yes. The plans are all the same. Are the premiums the same? No. Okay? How about an employer or a union plan? Sure. Some large employers, Teamsters or the post office, or there are plans out there for retirees. Federal employee benefit programs. You have to make sure that if you're in something like that, you have to look very closely before you leave because it's a one-way door. You walk out, you don't get to go back in. So make sure before you take that union plan and say no, that you know what you're looking at. Same with TRICARE for Life and veterans programs. We don't have the Indian Health Services in the area. It's part of Medicare, so we talk about it. There are 9 Medicare Advantage plans in Marion County, 10 enrolls to choose from for 2020. There are 28 standalone prescription drug plans. Does the 28 help me with the 9 or 10? No, because I can't mix those two together. But is there really 28 plans, am I really going to find that much difference between Plan 1 and Plan 28? You will in price. The other thing is formulary. What's a formulary, by the way? Anybody know what a formulary is? Formulary is the list of prescriptions that tell you what tier level. Is it tier 1 generic? Is it tier 5 for specialty drugs? Okay? And it also tells you what your cost factors are going to be. Formulary is extremely important. So, you have a sheet in front of you that Andrea was nice enough to blow up for us that gives you this in a big sheet so you can see it. These are the only Medicare Advantage plans available. So, is there an HMO on that screen? Nope. All PPOs. Wait, what's this PFF? Remember? So there is one, Humana has it, but it's actually less than their Humana plan up here. That's interesting. I'd like to do some comparison of that, see what real differences are. But now down here, what do we have? What's SNP? Special Needs Plans. We now have 4 different special needs plans in the area, except this one is not in Marion. Okay? Now, I don't know, I had one of the doctors ask me at lunch, what do these plans, I got to look that up. So I'll get that to Andrea and she'll get a note out on that. Okay? Can I buy from this screen? Can I tell what I should buy just from this screen? No. I can tell what it is, I can tell what a premium is, and I can tell, I got one plan here that is a 0 premium, but it doesn't have the RX. Okay? So, if I'm 65 and I don't take any prescriptions, can I buy this plan? Sure. Sure. But, remember earlier I said there aren't penalties for not purchasing a Medicare Advantage plan? That's true. But there is a penalty if you don't buy a drug plan. If you don't buy a drug plan, and you suddenly decide at age 70, I need a drug plan, and you haven't had any coverage for the last 5 years, you're now going to pay a 1% penalty times the number of months that you didn't have creditable coverage. So 5 years times 12, 60 months, times the average price of a prescription drug plan. This will be the first and only time you hear someone say that the government did something right. This is a wonderful website. It has been improved every year. It has more information than you're ever going to be able to put in your brain, but it is a wonderful site. You want to get familiar with this site. If your grandkids are around, they'll help you. Okay? But you want to know and be able to use this site. It's important. You can right now, if you wanted to go out there and say, okay, remember that sheet I had with those plans? You want more information? You can go here, you click right here. You can either create an account if you'd like, that's fine. You should. But if you just want to look for right now, you can hit that and say continue without logging in. That'll go over here. And what am I looking for? Put in your zip code, tell it which county, don't check anything else. Because I don't want it to narrow anything. I want you to see everything that's available. Okay? The next one, you got your zip code. Again, don't mark anything. Just go on. If it won't let you, I've had it do that a couple times, then just say, I don't get help. Because again, it's going to keep it to the broadest material. Do I want to see my drug plans? Yes. Do I want to add my drugs? Yeah. Okay? Last year, it used to be fun here because they would say, do I want to add my drugs? And if you said no, it would pop up, are you sure? Add your prescriptions. The best part about this, what's that? Find your saved drug list. If you enroll, you set up a username and a password, or if all you do is put in your zip code, your date of birth, and your Medicare number, it will save your drugs. And so 6 months from now, the doctor is going to change a medicine for you. You go back in here, you plug it in, you can figure out what your cost factor is for that new drug compared to all your other drugs. That's probably the best part about this whole site, okay? Because you see immediately how much that's going to cost me. Where is that going to do? When am I going to get into the donut hole? All that material is right there in front of you, okay? But here we go. 9 plans available. Humana Choice. Has a $500 deductible. Well, that's not bad. But what's out here? Okay? You remember, did Plan G have an out-of-pocket? No. Plan G does not have an out-of-pocket cost. $185. I'm sorry, I lied. $185. That's your out-of-pocket cost. Okay? Here, you got an exposure of $4,000 if you stay in network. Okay? Oh, I missed something there. It also had a zero copay for the primary doctor. So $500 deductible or zero copay. Okay? Here's some of the rest of it. You got to pay your Part B premium. Okay? So showing you your out-of-pocket costs again. Remember our difference between premium and cost? Okay? And what's our star rating? Well, in this case, this plan doesn't have a star rating. How many of you want to go to a 1-star restaurant? Do I really want a plan without a star rating? So you need to look at the rest of the story about the insurance company. Humana overall has a star rating. It's just this plan doesn't have a star rating. Okay? Because out-of-pocket expenses can be big, they can be unexpected, and they're not the same with every plan. So here's a quick sheet, and again, we didn't blow this one up for you, but it's on your sheet. So original Medicare, is there a premium? No. You do have the Part B deductible. You do have those copays and coinsurance. Here's Plan 1. I don't know which company. We just plugged this in. Okay. No deductible, but you've got your costs per day. Now, is there a coincidence that 275 times 5 comes out to 1,300? Don't think so. How about 3 1/4 times 6? That's actually $1,800, isn't it? That's more than original Medicare. All right. Over here, though, look at my RX prescription. Remember I said $435 was the deductible? This plan only has a $90 deductible. Okay? How's my scale? What am I measuring? What am I looking at? I have to look at the difference between what I spend in medical costs compared to what I spend in drug cost. Okay? Private fee-for-service plan. We know that's Humana, because that was the only one available. Okay? But even there, our drug deductible is low. But remember Plan G down here? We don't have a drug plan, so you're going to have to choose one of those 28 plans that are out there. But what's our cost? Here's our premium. Here's our maximum out of pocket. So 170 times 12 plus 185, that's my cost. Okay? Can I make a decision off of this chart? I hope you don't. This is illustration. It's not meant to make a decision off of. You have to look at your specific drugs, your specific healthcare needs. Okay? This is just simply trying to give you, how do I look at a plan? What am I looking for? So use this as a reference when you go to Medicare.gov and you're looking at plans. Okay? Medicare Advantage. It's insurance coverage from a current or former employer, union, military, or other source. It's Medicare and Medicaid savings programs. As the lady talked about, it means the insurance company is in control. They're going to do your authorizations. They're going to do your waiting period, your denials. Okay? Does Medicare deny coverage? Does Medicare deny a test? sometimes, pretty rare. Okay? Availability of hospital and physicians in the network. That's the most important thing. Okay? A couple of years ago, I was doing this, and little lady, I thought she was going to just cry the rest of the day because she was so upset. She had bought a plan that there were no doctors within a 50-mile radius of her. And she was stuck with it. She couldn't get out of it. Okay? So it's important. Plans premium in addition to the Part B. That $135 the government sends you a bill for, you can't get around that. You're going to pay it. Plan benefits, what and how things are covered. Your ability to pay the plan's out-of-pocket cost. Remember, this out-of-pocket cost, okay, that's your exposure. You end up in the hospital's going to want that one way or another. They'll give you a payment plan. They have to. They'll help you. But I look at this out-of-pocket cost and I look down here. Okay? You have to take that into effect. All right. The ability to pay the out-of-pocket cost, the cost can be considerably higher. Your use of hospitals and doctors. I've said this for many years. If you tell me how many prescriptions you're on, how many times you're going to see the doctor next year, you tell me that you're not going to move out of your county, and you tell me that you're not going to have surgery next year, and you can guarantee it, I'll tell you the exact plan to buy. Okay? I can't. You can't. So we're making our best decision. But you have to take into effect what you're used to now. What are you taking now? What are my medications? Are my medications going to change? How many times do I need to see my doctor? Are my doctor visits going to change? Okay? It's important to know what you have and what you don't have. Again, you do not have to enroll in Medicare Advantage. Medicare is not right for everyone. Take your time and consider your options. There's 9 plans available, depending on which county you're in. Okay? Somehow I skipped this morning. Identity theft. Do not give your Social Security card to anybody. Do not give out your medical card to anybody. Do not, on the phone, anybody's asking financial information, so on and so forth, do not give it to them. There's no reason. They don't need it. Medicare is really into, we want to make sure the fraud, waste, and abuse is cut down. We don't want open season on senior citizens. Okay? Changes happen each year. Cost, coverage, plan designs, pharmacies. You have to look at what's coming. Now, I tell people, because people are aging into 65, 10,000 people a day. You're going to get inundated when you turn 64. For the next year, you're going to get pieces of mail every day. You have to open that mail because Medicare sends things in plain white envelopes. They don't send it saying, I'm from Medicare, please open me. Okay? So I encourage you, open the mail, then throw it away. Okay? Make sure that it isn't something you need first. Don't just throw it away because you're tired of seeing the 3rd envelope from ARP. Okay? There are some places you can get help. Even though some of the local, I'm understanding, maybe didn't understand things. Medicare, you can call, you can go to the website. You can also call claim, which is important. This is on one of the slides. So you have all this included in your packet. Claim have certified people who understand the rules, the regulations, and how to help you. They're there to help you. Now, if you wait until the 14th of December to call them, they're not going to be too friendly. But if you call them, the 16th or 17th of this month, you're going to get somebody who's going to sound pretty chipper yet. If you're a part of the veterans, you got TRICARE for Life, you got the Veterans Department. Extremely important, most people who are using TRICARE or Veterans for Life, they don't have Medicare Advantage, they don't have a supplement. They're doing it through what the government will give them. Federal employee benefits, same thing. Railroad retirement. This is not United Healthcare. This is ARP, the senior program. Okay? So they're not going to steer you to a plan. They're going to answer your questions again. Okay? I always emphasize that because people look at me like I'm trying to sell ARP. No. Okay? Social media. Who wants to follow Medicare on social media? Okay. I love it. I think it's really interesting. Yeah, the networks are extremely important. You have to look at that and be talking to people before it's last minute. Okay? Thank you, everyone. I appreciate your time.